just played you some beautiful songs there. I hope she liked the other song. Song we played, and the other nobody's supposed to be here by Deborah Cox. Beautiful song, also from the 90s. I played that song in mind, hoping that it's something that you would know, something that would actually speak to you. Kunjani, MEC?
Thank you so much, Lester. Yeah, I enjoyed the music.
Yes.
Sapila MEC, thank you very much. You're looking beautiful on this Sunday afternoon.
Thank you so much.
MEC.
Nambe lizayo because ndiyabona uba usebenzile MEC before uze apha studio.
Izinto zakhe.
A lot of work has been done. You indeed look beautiful, MEC.
Thank you so much.
Thank you for honoring us. Yes.
This radio stroke TV.
Yeah,
Thank
you
you,
so much for
MEC.
honoring us. It's a great pleasure to have you. And we will be touching a little bit on some of the things that you're going through. Otherwise, how are you feeling today? How was your week, MEC?
Actually, I'm recuperating from a flu. I caught a
Yes.
flu during the Easter weekend.
Mm.
I was instructed to be in bed by my doctor, but I'm up now because I must work.
Wow. And uthi uneflu urecoverisha kuyo njengonjeni? Hayi awulwa kahle mos. No ulwa kahle ohlobo lulo ingathi awungathanga uyalwa. Ukhona umlo wenzayo. And so there's been quite a lot of things that's been happening, MEC. You know, the department oyiphetheyo is one of the busiest departments in the country, not just only upper province. And I actually also, you know, was saying to Spoke. I think I was away for some time. I had you know, an episode which made me in Dubandio Visitor Life, and my experience was really great. I've been Petrogakle MEC. And I think you have a lot of people who are really hard workers, people who are putting interest, you know, contrary to what a lot of people would say about the departments. I mean, my experience for me and the people, and I even asked a doctor there, you know, because I asked him that because whatever you hear about his Gabin and all of that versus the experience was completely different from me, and I really appreciated that. So I wonder, I mean, when you get a feedback like that, what does it do to you, MEC?
Yeah, it makes one feel very humbled and it excites one because, as you are correct, the clinicians are doing a lot of work. They go an extra mile. They go beyond the call of duty.
Yes.
But unfortunately, it is a department that is always looked at with a very critical eye.
Yes.
They only focus on the smaller mistakes that we do. For sure, when you work with people, you are bound to make mistakes, but majority of times we don't get the positive feedback. So we get excited when we get somebody like you are saying, telling us the experience that he or she had in our facilities. We get to be excited and we make sure that everyone hears that.
Yes.
So please, when you get to those moments, you must just shout, tell everybody that this is what we've experienced. Because unfortunately, the voice that is louder is the one that is always
The
negative.
negative
Negative.
voices.
Department, yes.
Yes.
No, I mean, it was one of the first things that we discussed when I came back because I had slept there for about 5 days, and I shared that on the radio, which spoke in terms of my experience and all of that. And I thought that that was a great experience, contrary to popular belief or, you know, to whatever is popular out there in terms of what people are experiencing. But I mean, enough about me, MEC.
I hope you paid. I hope they did charge you. But one of our mistakes, our shortfall as the department, is to let people go, the people who can pay us, because we don't have money. And in order for us to have money, the income must come from our clients also, because majority of the clients that we are servicing are uninsured. They don't have that kind of.
Yes.
So sometimes the system even lets go those who are supposed to pay. So I hope they
No,
paid.
they did.
They made
I
you
think
pay.
there was, I did hear asking for think 90 rand. I mean, it's
A
not a lot
folder
of
when you
money.
go
Yeah.
there,
They ask
you
for
have to
90
pay.
rand, and I mean, for me to do a great work, because the thing with the CT scan is very expensive. I mean, to get a CT scan from a public hospital free of charge, and when you have a medical aid or you go to private, even the GP was saying you can pay about 8,000. So those things, I think sometimes we forget the value of those things when we encounter the public service. We only are bombarded by the negatives and all of those things. So I really am happy to actually put that out there.
Thank you
MSc.
so much. Great to hear.
Spooky, I don't know, maybe you pose the first question.
Yes, of course, of course. Just a quick one to our listeners. You can catch us on the various platforms, and you can get us on our WhatsApp line, which is a 066. I'm sure you can see there my eyesight. I think I need to go to the hospital as well, get my eyesight checked. I can't see there.
066 137
27, yes, please.
Yes.
Yes. We might not have enough time, which has been allocated to cover all the questions, but we will just dive into the first question, MEC. Can you just elaborate and tell us on the fundamentals of the mission of the Department of Health? We know that is to provide, health services to the various people, but can you just break it down to us? What are the fundamental missions of your department?
Thank you so much once more. We derive our mandate from the Constitution of South Africa. Many sections there, Section 27, Section 28, Section 24. It talks to how are we supposed as a Department of Health to ensure that there is progressive provision of this health service depending on the resources. That's very important, because majority of times when we don't get to where we would like to get to, we get to be punished and to be charged. Yet it also depends on the purse. So what we are providing, as you all know, the healthcare services to our people. We've got many branches as a department. The other branch looks at hospitals and clinical services. The other one looks at district management services. The other one looks at corporate and human resource, where we are dealing with issues of legal, medical legal litigations, human resource. We are a department, huge department. Lester was correct when he said we're the busiest department, because we've got about almost 47,000 employees on our PESA. So we are a human resource-based organization, hence the importance of this branch that looks at corporate services. Another issue that is very important in terms of what we do is the provision of security, in particular to our facilities. We are a 30 billion rand, 30 billion rand budget department. We've clocked the 30 billion this year when our MEC was giving us the budget, at least we got to the, but almost 20 billion of that goes on human resources. Then the rest goes on capital, the infrastructure projects, and also goods and services, because we provide also EMS, that is ambulance services. We provide, we buy medicines. We spend almost 2 billion rand every year just for medicines and all the other medical consumables that we use at our facilities. But the number of hospitals that we have, we are the highest in the country in terms of the number. Got about 92 hospitals.
In the Eastern Cape.
Yes.
From a small hospital called district hospital to a regional hospital to a tertiary hospital. We've got tertiary hospitals that is Livingston, Frey, and Nelson Mandela, and one central academic hospital, which is Nelson Mandela. But we've got also specialized services, in particular when we talk of issues of mental health services that we are providing. Our tertiary hospital for specialized services is Fort England. So we provide a plethora of services across those hospitals, including clinics. Our clinics are at excess of 800. 742 clinics plus about 52 community health centers. So in total, we are close to 1,000 the facilities that we are having, where you find these warm bodies that I'm talking about, including our support offices like your head office and district offices. But what we do is to ensure that people of the Eastern Cape are healthy. It's not health, as one scholar once said, it's not absence of diseases. It is a human being wholly. So the health is very important. You don't wait until they are sick. That's why even if you talk of issues of malnutrition, you find us there. If you talk of wellness, you find us there, because we'd love to empower our people, educate our people so that they prevent falling ill. So that's the work that we do as a department. It's quite a very busy and cumbersome job that we are doing, but with the help of all the dedicated staff that we're working with and the partners, of course, we are able at least to make sure that there is access. You see, with this government, there is a norm, a policy that at least people must have at a 5-kilometer radius a clinic. So we are trying to ensure that every community has a clinic at a walking distance.
I remember, I think it was a week or two ago, where there were, I think, mobile clinics or that were handed over. What impact do you think that is going to have, especially to places where getting to e-healthcare services is quite a challenge? Because you hear people saying that they have to travel maybe like 20 kilometers, and some don't even have transport. What impact does that have?
Yes. Thank you so much, Spocky. As I said, we are trying to be accessible to the people. Sometime last financial year, but in 2023, we handed over 54 mobile clinics, and just now in March, we handed about 79. We are adding to those clinics that are fixed structures, because as you correctly say, we've got a serious challenge of access. Sometimes a clinic may be within the 5 kilometers, but still it's not easy to reach, and as such, it's not easy to get public transport and all those things. So others, they still have a challenge of having clinics far. Others, not even clinics, they must go to town to get to a hospital or a town clinic to be assisted. So we are trying to cap that gap by having these mobile clinics. These mobile clinics are a very exciting model where you find everything, and inside you get the fridges, the microwave, you've got the water sink like a basin, you've got electricity. When it is parked, it can idle and supply electricity, or it can switch off. Then there's always backup. They even have generators that they are going around with, and majority of them, they are 4x4s, understanding the topography of the Eastern Cape. So it is relieving us a lot, at least to ensure that when there is no facility, there is no fixed structure of a clinic, our people can go to them, because it is a clinic that goes with the staff. That is the stuff that you get to a clinic. And you go beyond that, we've got even a bus now. I think you heard about the bus.
Yes.
It was donated to us by another mining company, our partner. They spend about 6 million for that bus. It's for integrated school health program.
Oh,
so we
wonderful.
go there with it's got 3 consulting rooms inside it. So these mobile services, they help our people, because they go to where they are in cases where they can't come to our facilities.
Wow, wonderful. Obviously, this is one of the achievements, but can you just give us more insightful reflections on the notable achievements during the tenure of this 6th administration?
Okay. Firstly, I think it's important, even though we talk about the 6th administration, to just remind our people where we come from.
Of course.
Before 1994, we had a system that was so excluding, in particular excluding the majority and discriminating. You can't believe, in terms of allocation, that it used to be about 55 rand per capita allocated to the black community population. Remember, we had these 3 standalone states, Transkei, Ciskei, and the apartheid South African. So the system was like that. So we had to amalgamate the system, and the per capita for the white people was 591
Imagine.
rand per capita. 55, that only 10% was allocated for a black person. So we had to amalgamate and ensure that that system is integrated to be a system that serves everybody. And looking also at the ratio, doctor-patient ratio, it was one doctor for 282 white population, and one doctor per 53,500 of the blacks.
Wow.
So we come from there. Inclusion was introduced by this government. But we are proud to say, as we speak, trying to undo the damage of 300 years. Yes, our people may say it's too long to be at 30 years, as we'll be celebrating 30 years on the 27th of April, but there is a lot of achievement that you can brag about, as this sixth administration taking from where the fifth administration left,
Of course.
including the plans that we'll be doing should we be voted back into power as this organization. We are proud to say, as I said to you, we've got so many. We've built a lot of hospitals. Firstly, there is a program that we introduced in 2015 called CCMDD. It's chronic medication dispensing and distribution,
All right.
where we don't want our people to falter, to default in taking the chronic medication. We bring it to them, and as such, we've come up with many pickup points. Actually, we've got about 419,270 patients that are receiving this CCMDD medication from the pickup points. And we are happy with the partnership that we are having, because these pickup points, majority of them, they are not the public health facility.
All right.
You find them at the community, find them at towns, at the halls, at the pep stores, at
All right.
the traditional leadership places, Gamakomkulu, where we deliver this, so that our
right.
people, they know. There's also an SMS system that tells you that your pack now is being delivered, you can come and fetch it. So that is a notable achievement in trying to deal with the chronic medication. It is for that reason why even now, when I spoke about specialized services, hospitals or facilities, we don't have a lot of TB hospitals, because now, as part of the developments and progress that we've made, we are able to manage TB patients, not necessarily in a hospital, at home, through ensuring that we give them these medicines whilst they are seated at home, deliver to close up from where they stay, including after the COVID-19, we had a serious problem of loss to follow up. So we had a program that we said it's welcome back, in terms of ensuring that our people are looked for. I will go and look for them and we get them, so that we can give them, including the issue of HIV/AIDS. If you remember HIV/AIDS, it was a killer disease before. And
Yes,
as we speak
indeed.
Now we are the first province also that had launched what we call U is equal to U. Undetectable equals untransmittable. So if you are able to suppress, because we've got this treatment that we are giving, the IRTs, then if you suppress into an extent that when you go and test, it's not detectable, that means you can't transmit it. So
Yes.
there's a lot of work that we are doing. Again, talking on the issue of the young people, we've got more than 515 youth zones for adolescent and children, boys and girls. Because our young people, they don't like going to a clinic.
Of course.
And sometimes because they're at school, you go to a clinic, you get there's this magogo who's opening eyes to you to say, and you, what are you coming to do here? Because others are looking at the issues of teenage pregnancy and
Of course.
reproductive health, all our contraceptives and stuff. So these youth zones are dedicated for young people. They don't queue. Even the entrance is a private entrance,
All right.
where they can be able to be there. The setup is such that they can sit in groups, that they can share all the difficulties that they have in life. So that also is making our health service cool, because our youth now, they come and they are able to be serviced with no waste of time, no queuing, a convenient space and privacy. So that's work that we are doing. Where we are also big is at the infrastructure, because the majority or almost all the hospitals I'm talking about, we inherited them, and they were mud structures. Clinics were mud structures. Hospitals were houses of missionaries that were given to us. So we are building state-of-the-art hospitals.
Yes.
You know, we just went to Spade where we built more than 680 million facility there, close to 600 million at Khutsong in Matatiel, which used to be a TB hospital, which will be changing now to be repurposed to be a district hospital, because there's not many people that we find sleeping in a hospital because of TB. We've got the same age that we all know about, which is also, when we are there, one minister said to me, I went there, I thought I was in another country. I don't mean just the building, the cleanliness, the care that you get when you get inside it. So it's a multi-billion. There are other projects. As we speak now, the day after tomorrow, we're going to visit deep rural in Port St. John's, a hospital called Bambisani Hospital, also built at a tune of about 700 million. When you go towards a case deep between Elliot and Elliot Dale and Mkanduli, there is a 1.2 billion project that we are building as a Tulele hospital. The list is long. When you go to Flagstaff, another deputy minister was calling me to say, no, come and reopen this HC in Flagstaff. I've never seen something this beautiful.
Wow.
I said, we did. Obi said, no, we didn't hear you. You must come and reopen it. So we've got those facilities that are bringing dignity to our people, but at the same time ensuring that the best care, we want to be even the best offer of service than the private sector. Actually, I've been receiving feedback to say even the private sector sometimes is not giving quality service as we do. There was one friend of mine was saying, I'm in hospital, I've been here for 11 hours. Because we are very critical about waiting time.
Yes.
Of course, because it's a free service. Many people come there. We can't sometimes be able to give what we want to give. There's a clinic that I visited called Genge Clinic. It's on the other side of Mtata Nkanduli, under KSD, where they are having what is called ETIC. It's a small clinic, but it's a beautiful NHI clinic that has recently been built in 2019. It was handed over in 2019. There, it's 45 minutes time that you spend counting from entering the gate and leaving up the gate. That's the way we are saying we are trying to professionalize and we are trying to do good in terms of servicing our people. The list is long. I can mention your Alwal North Hospital, which is a hospital I've never seen. When you get there, when you even in the laundry, what is called the dirty area in the laundry,
it's
you
clean.
think it's a clean area. When you go to the where they keep their laundry, where they pack it, it's so beautiful.
Yes.
So the work that is done is just exciting because our people are committed, but also as this government, we want to make sure that the facilities that we are building, the services that they are giving to our people are the best services ever that they could get in the public sector, free of charge, as you know. So that's what we have done so far, and we are very proud of ourselves.
As you should, because that's quite great achievements, because we know that Tinabanduke that grew up in the late 80s, to the 90s. We know the struggles zabantu basezlalini, for instance, when we used to go to ezlalini, kuthiwe no awukazubheka kule clinic because either ivaliwe or whatever the story is. So it's quite refreshing to hear that a lot has been changed and integrated from before 1994. But Lester, are you going to go into the questions from our listeners?
Yes. MEC, we've got some questions here from listeners. One of the questions is, how far are you with the public-private partnerships?
That one is the one that is putting us high up. We are even achieving milestones that we could not achieve on our own. And we decided that it is the way to go, understanding our issues of fiscal constraint. So the public-private partnership has led to us, if I can just mention a few. For an example, there is a program called Umbono that is conducted by Kiredi Stroke Small Projects, where more than 5,000 kids from last year, November, were given glasses, spectacles. And we've got a donation of 8 ambulances, stroke mobile clinics that are going to our people, targeting the youth in particular. And that particular partnership is doing wonders for us as the Eastern Cape. But beyond that, there's also partnership with NGOs. Almost all the work that we are doing in partnership. We fund NGOs, we work with the international donors, and we've got other partners that are helping us to get to where we would not have gotten if we were working alone. And we are very proud and grateful to the partners that continue to help us as a department. As I shared earlier on, the issue of the bus that we received for the Integrated School Health Program, there's a lot of work that we are doing with our partners. Otherwise, we can't walk this journey alone. But even COVID has taught us that if we work together with partners, there's a lot
Can be
we
achieved.
do. We worked even with the churches, traditional leaders, and all other NGOs. So there's great work that we are doing with many. If I can mention, I think my time can get finished without even saying other things.
Yes.
Of course.
There's a lot, right to care, booming homes. So a lot that we are doing, including providing health at the community level with what we are calling ward-based primary health community outreaches. So it's WAPCOT in short. So there we are working with many NGOs, and they are making us to be able to achieve at least to even the health outcomes that we would like to achieve because of them, looking at the issues of the mother and child health issues, looking at mental health is another area where we are paying a particular focus as the Eastern Cape, the mental health services, because our communities, because of many social ills, social determinants of health, in particular drug abuse and all that, we are seeing a lot of young people coming to our facilities having serious challenges of mental health, but working with our partners, we are able to provide this health service. And the mental health service, again, I think we are the province of the first things, because we are the only province that has a director at that level to show how serious we are taking the provision of that particular mental health care to our people. So the work that we do with partners, I can just list and list. It's something that is beyond what we would have imagined, that when we work together, we can reach so much communities in terms of numbers of people that we are able to service, because we are working together, including stretching beyond our limit in terms of financial resources, because as I emphasized, the Constitution says within available resources. So we don't want to be comfortable to say, no, we can't do that because we don't have money. So we want to work with our partners to ensure that we reach out to the last person of our province.
Yeah. MEC, we got quite a lot of questions coming through. I have a question from Kwangam Tuchane, who says, please ask her about the promise she made on the 5th of July 2023 at the nurses graduation, that ComServe will be absorbed after absorption had stopped since 2019. So the question is on ComServe basically. ComServe of 2023 are currently sitting at home jobless. So that's the question coming. I don't know if, maybe let me pose a question through and then we'll go through other questions.
Okay, let me try to be straight to the point.
Yes.
No, there is no ComServe that is sitting at home, not in the Eastern Cape, unless that ComServe did not apply. It's not absorption. We advertise, and the commitment that we made, even now we're going to issue a statement that says how many community services that we had that we've
Absorbed.
Not employed.
Employed.
All of them. I'm telling you, even last year there was no one remaining except for those who declined. We're not absorbing like we did before, but what we do, we advertise. This financial year we've got a dedicated fund, 380 million just for the ComServes. So we won't leave anyone. Unless those people, because it's not compulsory that they apply with us, they can go to other provinces. We are one country, we are a unitary country. But those who apply, we make sure that all of them. We were focusing initially on the bursary holders. Now we are taking everybody who comes to us. Of course, depending in terms of the vacancies, but with our 515 almost, if I'm not mistaken, 502 ComServes that we had for 2023, 2024, this financial year 24-25, all of them, they shall be employed.
Wow.
All right.
And then Ulonabo Gold is asking the MEC, why have they not implemented plans to deal with the long-standing issues of medical legal claims which have crippled the entire health system. When will phones work? I don't know if the phones are not working, the experience that some people are having out there.
Yes, we want to apologize to our communities about the phones. Our phones are currently down because of the serious issues that we are facing financially, but that is being resolved. And there is an alternative number that they might use beyond the one that you normally use of the call center. But coming to the issue of the medical legal, you know, that's one area that I'm very proud of my legacy. When I exit before 29th of May, I will be proud when I look back and I see the interventions that I have made when I joined the department. And I got to the department, we were already being assisted by Treasury, by OTP, by SIU, a tripartite arrangement working with the Department of Health, of ensuring that where we need to investigate, SIU investigates, because there's a lot of fraud that happens in that space. But where we need to strengthen in terms of our own systems, we must do something, defend and all that. But when I got to the department, I saw that there was no legal services unit. There was no one. There was only one director with interns, 2 interns. As I speak with you now, I've got a fully fledged legal unit to ensure that one we defend. Because one of the serious issues, it was because when these people take us to court, we could not defend ourselves. That's why now, after the intervention of the OTP and Treasury, there was some breakthrough in terms of at least us being able to defend ourselves. When I got there, there was almost R1 billion every month that was getting paid for medical legal litigation. I'm telling you, 2020, I got to this department in 2021. 2022-23, we dropped it up to just less than 400,000 for that year. The reason why it went to 400 something thousand, because in 2021-2022 it was only less than 60 million. But 22-2023 there were cases that were coming from 2017 which were the writs were stayed because we're still arguing a very big public defense case, which we won that case, but there's an appeal. But now we've since been joined by the whole country to say, if then we are found to have erred, to be on the wrong side in terms of the service that we give, we can't take all the money, 60 million, to one person. Because at the end of the day, you find that these people, they turn back and they come to get a free service from us. So at least if we are found to have made a mistake and we must pay for this particular cerebral palsy patient, it must be through a service. So we are arguing that that's what we have managed to win at Grahamstown. But since then, we are spending less than 300 million per year as compared to the 1 billion every year. So there is some work that we are doing. And we are not ending there. We are strengthening our clinical services.
Of course.
I've got teams that are working. I even took back the retirees, retired nurses, to come and be able to say that we are making sure that if there is any litigation that we can, litigious case that we suspect, we must be able to start to engage with the family so that there is a way of reconciliation and ensuring that we discuss before we can be taken to court. The third element was the issue of e-records, because we're using physical files. We are at advanced stages now with ensuring that there is e-health, e-records, and e-PIA, because there was time when even people, they want information, they couldn't be given. So with the e-PIA, it's a matter of you just lodging your e-PIA, then you get to get the information, saving about 60,000 per case, because just not responding to a case, we're paying 60,000. So there's a lot of work that we are doing in ensuring that we've got this electronic record so that we are not found wanting when we must go to court, because there was collusion between our officials and some other people, even steal the files. When you must go and defend yourself in the court of law, you don't have a file. So there is quite a great progress that we are making at that level of medical legal.
I like that, because I think that's one of the things for me that I kind of experienced in terms of the discussions that I had when I was in hospital, that those were some of the problems that the department was encountering, the collusion between staff and or sort of patients and lawyers as well, in order to actually put the department into litigation, so that the department then, is disadvantaged because of those collaborations. So I think it's a great point there. Well, Umam Nobom Bobochani Nini is asking, MEC, are you aware of Unjani clinics that are about 18 in the Eastern Cape offering comprehensive primary health care services? I don't know if you are aware of that, MEC.
Hey, there's a lot of NGOs that we are having in the province. I've not met the Unjani. I would love to meet them so that we're able to see the work that they do. They help us, but there's a lot of also private and NGOs that are offering services in the province. I'm sorry that Unjani, I've not met them.
All right.
I think, we are running out of time, but I just want to put through some. There's Umfundo Sobele is saying, beyond providing better quality health services, how have the new state-of-the-art facilities contributed to the transformation of the localities, particularly rural areas? And then he continues to say, well done to the department for the great facilities that you are providing at the moment. Infrastructure, saying well done on that. So basically the question is around the issue
Impact.
of the, yes.
Yes. You know, we are starting now. Thank you so much for that positive feedback, Mr. Sobele. We are starting now to decentralize our district health services. We take the tertiary services from Nelson Mandela Academic Hospital to a district hospital. We are decentralizing the tertiary and regional hospital services to district hospitals. We're taking to them as far as Mazikane Zulu, to as far as St. Elizabeth, where there is a vastness and the rural nature, where people can't afford to get to the higher level of care in terms of health services. So having these facilities like your Superior Hospital, it makes the work so easy for us to take specialists to go and operate there. So there is good working relation between the CMH, Frey, Nelson Mandela Academic Hospital, and the hospitals you find in Kabeja, like your Livingston and Dorangenza. They work in collaboration. So we are starting in earnest to decentralize all these specialized services to where people are, because now we've got the machinery, state-of-the-art machinery. We've got the places in terms of these big facilities that we just built for our people to be able to be consulted there in those facilities. So it's quite a great a success story that we're having, and it is benefiting our people a lot.
Yes. Just one or two now, MEC. Darlene DeForce is asking what is happening with the laboratory coordinators whose contracts were not renewed. And she says only told on Thursday without any prior warnings. I don't know if you know anything about that, MEC.
Darlene DeForce belongs here. She is a GM who just left the department. I just discovered that there is that anomaly that was done by my senior management, because these laboratory consultants she's talking about, they are not in the organogram, the one that we are utilizing. In South Africa, in this government, if a post is not in an organogram, only the MEC has a right to approve that. But unfortunately for this, I just heard recently that they've been in the department for 9 years. And it was not through the approval of the MECs.
Before you.
Yeah, even me. I don't know, because it was an annual contract. If it's renewed, actually the Public Service Act says if it's not in the organogram, the executive authority, which is the MEC, may authorize it for a period not more than a year. So if then it must go beyond a year, still it must be the executive authority, which is the MEC. So if they've been renewed for 9 years, it's what I said in the meeting that I had. I had a meeting yesterday with the acting HOD. They must investigate who's responsible for that. But because we need the service, because these people are gatekeepers, we'll see how we do it in a manner that is legally correct. But our people are assuring them, because we need their service, they shall be employed, but employed in a right manner, not on like how they've been engaged with us.
I think we'll take one last question, MEC. We're running out of time, guys, so please, we apologize that we'll be rushing through this. The one question from Pindos Banya is, how will the new Cecilia Makiwane maintenance in new infrastructure, as that hospital is leaking when it's raining, semi-oncology at Frey as well. So the issue of unskilled workers being employed in key positions. I don't know if you're dealing with that. Do you have any problems of that nature?
No, it's not unskilled workers. You remember this government decided as we deliver services, there must be beneficiation of our small, medium businesses. So sometimes I think when these big business people like the company that was building CMH, when they get contracted, they subcontract because it is law of this country, of this ANC, to say, if then you come because you are a grade 9 or whatever, but you must ensure that you empower the small, medium businesses. So in that process, there are faults that we find. So the leak that was there, it's being fixed at CMH. It was a default, something that is a snag from a contractor. So it's not like it's workers that are not skilled and all what is being claimed. But we are taking good care of that. ECMH is one of the hospitals that are well looked after. As I was making an example to say, this deputy minister said to me, when I got inside, it was like I'm working in another country, but even the service. We've got a very capable CEO there, Mr. MC, at CMH, looking at that. The oncology is the area where we are providing the oncology services to the entire population of the Eastern Cape, in particular from the eastern part and the central part, because we don't have another oncology unit or hospital except for Frey. So people traveling from as far as Mbizana, Lusikisiki, they come here. But there is always a misunderstanding because there is a J2 ward that is there, which is a ward which I think the CEO, acting CEO, Mama Bato, they are going an extra mile. My mother died. She had a cervical cancer. I had to look for a relative for her to stay here because it's difficult to go every week, come to the oncology to get the services, because about 700 rand a return for those who are coming from far. So the hospital said, we are offering you this space for you to be here whilst you wait. They are not even budgeted for, because they are not inpatients. But I said again to Ms. Nokwe, because that was brought to my attention, that now people understand that government must do everything, must cook for them, must clean that place, even though minimal support is given. They are given, we've got TVs there that they are watching, we've got one cleaner that is looking after that, but it looks like it's not enough. Maybe again it's the communication, because I don't think people who've got relatives who are getting this care from Frey, they must just leave them like that. There must be a way of meeting government halfway. But again, Ms. Nokwe, my acting HOD, is getting partners. I instructed her to say you must look for a partner who can help us at least to get the basic things for the people who are kept there, who are coming for oncology services at Frey Hospital.
MEC, there's a lot that we can talk about, but I do want to thank you very much for coming through, recognizing the time also on your side to put yourself in one being. But I also, just on my side, I do want to thank you for basically the work that you're putting in. There's definitely, in terms of what people are saying, some improvements that are happening. And if you, the question that I was going to ask, which was the last from me, was going to be around, if you continue into the same sort of position in the next coming administration, what would be your thinking be around in terms of the next sort of 5 years as we close MEC?
I'm not even in the list. So that chapter is closed. I'm not going to be part of the provincial government come after 29th May. Yes, but I want to just please request our people for now to use the interim numbers that we are having in terms of getting to be assisted. It's not all facilities that are not reachable because of the issue of the call center that is down, but they can still use the number in the interim, the 0437110693. It is the number that is Telkom number. There is an issue of outstanding payment that the CFO is dealing with, but I'll give you the numbers for now for my relevant DDG to call him for those numbers, for these services where you are not able to get through because of our call center and our telecom number, which is 083 378 0111. It's an interim arrangement. They are hard at work in ensuring that all the call center numbers and the numbers that are toll-free that we had, including I instructed them now to have a callback number, because we must be able to service our people, even those who don't have money. So I think it is a matter of about 2 weeks or so. By mid-April, we shall be able to come back to our people and say the numbers that they've been using are now available. But for now, it's 043 711 0699, which is the telecom number.
One is not
Yes, but the telecom is being, the issue of the payment is being corrected by the CFO. But for now, I'm giving them the one of the DTG so that we can be able to communicate whenever our people have problems. But AMK is 24/7. And as a band, where do they get my number? But because I'm working in the Department of Health, even if you call me at night at 11, if I'm still awake, I do try to help. Send me a WhatsApp. I have a chat room with all my middle managers and senior managers. When there is a challenge, please share with me on my WhatsApp number. I'll be able to help you until the matter of the lines is sorted.
Okay, thank you so much, MEC, for that. Ladies and gentlemen, we really have come to the end of the interview. MEC, your last words.
I want to thank you first, Keith Ngesi, Radio Stroke TV, for being the microphone with which we can talk to our people, and thank the people of the Eastern Cape for their support and understanding where there are glitches in the services that we offer. But I want to say we are committed as both the political leader of the department, the senior management and all officials to serve our people, to ensure that the healthcare service that they deserve, they find it, and it is a quality one. We'll be going to villages now. We've got outreaches that go to as far as Mfundisweni, Siphethu, Kwanopoi, and across the province to ensure that our people are serviced. We bring doctors there, services that are not normally found in the villages, because we are committed to serve. So we thank everybody who we are servicing for the understanding and the patience where there are serious glitches. Thank you so much.
Thank you, MEC. Wishing you all the best in your future endeavors.
Oh, ladies and gentlemen, that was our MEC, Umama Nomakhosazana Meth, telling us about the work that they are doing in the Department of Health, which I can attest to personally with my own experiences. So do engage, the number that is on the screen there it's a DDG, number got DDG.
Maseko, yes.
It's 0833 780 0833780111. That's the interim number. It's a temporary arrangement at the moment, so you can contact the DDG.
Nompumelelo Maseko,
Nompumelelo Maseko,
the one for communication.
For communications. Guys, please don't abuse that number. That number is for emergencies. If you can't get, because you can't get through to the call center, so that number is the one that you can utilize at the moment. Thank you so much. MEC, all the best in your future endeavors, and we love having you here. And thank you so much for giving us the opportunity to come through.
Thank you for having me.
Wow. Guys, we are going to end this with a beautiful song, of course. I mean, MEC